Happy Wednesday Night Live. That is right. We are back for another exciting practice exam to help you pass your CNA and your patient care tech, your PCT exams. And so my name is Eunice Mathis. I will be your instructor tonight. So welcome to our live review. We're discussing the urinary system. And so let us go ahead and do an overview. The urinary system includes the kidneys, ureters, bladder, and the urethra. Its main job is to remove waste and excess fluid from the body by producing and eliminating urine. The kidneys filter the blood. The ureters carry urine to the bladder stores it, and urethra allows it to exit the body. And so anytime you need an overview of the urinary system, just come back to this video and look at this slide. And I see you all in the comments saying that you passed your examinations. I am so proud of you. Why learn about the urinary system? First of all, it's to detect problems early. You, as the CNA, as the patient care tech, may be the first to notice changes in the urine color, smell, or amount. Those important signs can indicate infection and/or kidney problems. Next would be to help in the prevention of infections. Of course, good hand hygiene, perineal care. When you think of perineal care, think of anything that would be in the diaper or a brief region, whether your patient is wearing briefs or not. So if it's a woman, that's going to be the vagina, the rectum, and the buttocks. If it's a male, it's going to be the penis, the testicles, the rectum, the buttock. And don't forget about those inner thighs. So anywhere that urine or fecal matter would be, that's what we refer to as perineal care. And then the catheter is a flexible tubing that your nurse will insert, and that drains the urine out of the body. So whenever we're talking about preventing infections, dealing with the urinary system, as the CNA, you have to be concerned about perineal care and catheter care, because doing both will help prevent urinary tract infections or UTIs, especially in older or immobile patients. Next, let's talk about the fluid balance. And so maintaining adequate intake and output is key to identifying dehydration or fluid overload. So when we ask you, to do all of your documentation, hey, how much fluid did Miss Jones intake? And you're like, oh, I didn't keep track. I didn't, get to her in time. That's something that, maybe once we understand, but if that's a habit that you keep doing, I'm going to ask that you don't do that, because we have to know what's going in, we call that intake, and then what's coming out, we call that output, because it needs to be balanced. If one is greater than the other, that means the patient could have fluid overload, or if it's the opposite, they could be dehydrated, either of which will be bad for your patients. Now we're on better reporting. Understanding the urinary system helps you to communicate clearly with your nurses when problems arise, thus improving patient outcomes. And that's what we're here for. We are here for the patient. So let's get ready for our practice test. We've done our overview. You can always go back and watch that. Now I need you to make sure that you have pen and paper available, because we're going to talk about the structure and the function. We're going to talk about common urinary problems, and then what actions you as a CNA or a patient care tech should take based on those patient observations. And yes, we'll also discuss catheter care and hygiene basics. So here's your tip. Read each question carefully and think like a CNA. Remember, you already have the heart of a caregiver. Now we just have to prove it by making sure you understand and you have the knowledge. What can you do to help the patient based on your training and your role? So we're going to stay within the scope of practice of a CNA. We're going to do what we can do, and anything else, we're going to escalate it. We're going to make our nurse be made aware. We offer so many classes. We even now have online medical assistant classes. And so this program is super special because in addition to it being MA, it also includes EKG tech and also phlebotomy technician. And yes, it is hybrid. You study at your own pace. your own time. And then whenever it's time, whenever you're done, you'll be taking your clinicals, completing the rest of your course in your own area. So you don't have to come to Florida. And I love that. And I love our partnership with Career Step. So if you would like more information, I'm going to ask that you go to the website shown on the screen, which is floridacareeracademy.com, or you can call one of our advisors at 877-225-7151. I'm excited. Question number one, team. Which of the following is a normal age-related change in the urinary system? Is it A, increased bladder capacity, B, increased ability to concentrate urine, C, decreased kidney function, or D, decreased risk of urinary tract infections or UTIs? Which of those would be normal age-related changes? Right, revealing the answer in 3, 2, and yes, if you chose C, you're absolutely correct. So as people age, their kidney function naturally declines due to reduced nephron efficiency, which can impact waste filtration and fluid balance. Let's go to question 2. A nursing assistant is assisting a patient with stress incontinence. So that's a new term. You may want to write it down. Which action is most appropriate? A, encourage the patient to drink less water. B, restrict the patient's mobility to prevent accidents. C, advise the patient to wear a catheter at all times. D, instruct the patient to perform Kegel exercises. Right. And I do see some great responses in the chat. So great job, caregivers. Keep it up. And if you chose D, yes, remember as a CNA, you focus on non-pharmacological remedies. And so we're not going to tell a patient to wear a catheter. That's not going to happen. And then plus we don't wear catheters. They're usually inserted unless it's a condom catheter. But what you can do instead when it's stress incontinence, and I don't want to give you the answer just yet, so write it down. I'll give it to you later. But with stress incontinence, they have to build the muscles in their pelvic floor. So what you're going to do is you're going to ask them to squeeze their butt cheeks tight. And whenever they squeeze their butt cheeks, especially while they're seated, they're going to feel their pelvic muscles move. And you can do the exercise right now while you're seated. Here's the rationale. Kegel exercises strengthen pelvic floor muscles, which can help improve bladder control in patients with stress incontinence. So if you knew that, give yourself applause. Question 3. What is the best dietary recommendation for a patient with chronic kidney disease, CKD? Chronic, they've had this kidney issue for longer than 6 months, okay? It's been a long-term issue. Now we have to change the diet. What would be the recommendation? Would it be A, low sodium, low protein diet? B, high protein, high potassium diet? C, high dairy, high phosphorus diet? Or D, high sodium, high fluid intake diet? Think about the role of the kidneys. What does it do? All right. And so, everybody, the kidneys filter waste and they remove excess fluids. So, let's not give them anything that's going to cause fluid retention. So, if you chose a low sodium diet, you're absolutely correct. It's low sodium and low protein. And here's the rationale. A low sodium diet helps to prevent fluid retention and hypertension, while a controlled protein intake reduces the workload on the kidneys. There's less to break down. Okay, so low sodium, low protein diets for your patients with chronic kidney disease. Question 4. Which of the following is a primary cause of urinary tract infections or UTIs in a female patient? Would it be A, frequent hand washing, B, dehydration, C, shorter urethra, or D, consuming cranberry juice? Primary cause. Yes, yes, yes. Here's an image to help you understand why C is the correct response. Women have a shorter urethra. When you think of the urethra, think of the tube that allows the urine to escape the body. And so a woman's urethra is relatively short. Meanwhile, a man, because of the length of his penis, his urethra would be longer. So, rationale. Women are more prone to UTIs because their urethras are shorter, making it easier for the bacteria to enter the bladder. Question 5. A patient on dialysis should avoid which of the following foods? Would it be A, apples and chicken, B, processed meats and bananas, C, white rice and green beans, or D, unsalted popcorn and berries? Now, think about the previous question that talked about diet and kidney disease. So when someone's on dialysis, that means their kidneys have stopped working and now they have to be put on a machine that's going to clean their blood. And so we want to have all of their foods to be easy on the body. And so we're going to avoid B, processed meats and bananas. So processed meats are high in sodium and phosphorus. We just talked about that. The kidneys can't really excrete those toxins. So we're not going to give them anything that's going to build up toxins. And then your bananas become a concern because they contain high levels of potassium. And too much potassium can cause the heart to go into an irregular rhythm. And so your patients who are on dialysis, I know their trays look meek and meager. They're not really happy about their dietary restrictions or the trays that are going to be brought into their room, but we have to limit their sodium, their phosphorus, their protein. Otherwise, we're going to cause their kidney condition to become worse. And that's going to be very dangerous for them. Question 6. The best position to place a male patient during a catheter insertion is which of the following? Is it A, supine with the knees bent, B, sitting upright, C, side lying, or D, supine with legs extended? And as a CNA, no, you do not insert the catheters. But what do you do instead? You help me. You go get the supplies. You hold the patient's hands if necessary. You hold their legs. But you have to know what these different positions mean. And so supine means flat. Okay. And so, yes, whenever the nurse is inserting a catheter, the patient needs to be flat. But how should their legs be? So is it A or D? And great job. It is going to be D, you all. Supine with the legs extended. And so in this image, the patient's in like a semi-Fowler's position, but it should be the tolerance. So lying the patient flat with their legs extended allows for easier access to the urethral opening for catheter insertion in male patients. Question 7. Which of the following signs might indicate worsening renal failure? Is it A, increased appetite, B, high urine output, C, swelling in the legs and the feet, or D, low blood pressure? All right, I'm so proud of you. Absolutely. Remember, they can't get rid of the excess fluid, so they may have C, swelling in the legs and the feet. So edema is a common symptom of worsening kidney failure due to fluid retention. That's why your patients who are on dialysis or if they have kidney failure, we have to do daily weights because if they start retaining too much weight, that's going to let us know that their health condition is not improving. Question 8. The best way for a CNA to assist a patient with functional incontinence is to A, offer scheduled toileting assistance, B, encourage the use of bedpans only, C, place an indwelling catheter, or D, limit fluid intake. And the way that you assist someone with incontinence is try to prevent an incontinence episode. Okay. Remember, as a CNA, you do not place any catheters. When you're in the hospital, they change your name, they change your title. At that point, you may be trained on sterile technique and how to insert a Foley or your indwelling catheter. But remember, for your CNA test, that is not the scope of practice for a CNA. So with all that being said, you're going to prevent episodes of wetness by doing A, Yes, offer scheduled toileting assistance. Scheduled toileting can help patients with functional incontinence manage their urinary needs more effectively. So, if you have to do a visual check on them every hour, every 2 hours, when it'll be time to turn or reposition them, you'd ask, would you like to go to the restroom? If you see them drinking and it's been longer than 2 hours and they've not gone to the restroom, that would be your indication to get them up. Otherwise, they're going to be incontinent. They're going to wet your bed. Question 9. Which electrolyte imbalance is common in end-stage renal disease or ESRD? Is it A, low potassium, B, high potassium, C, low sodium, or D, high calcium? So end-stage renal disease, you all, is dire. I mean, they're at the end of life at this point. So what electrolyte is going to be out of balance? And I know you know the answer. Don't second guess yourself because it is B. That's right. Look, the kidneys are not working, so that potassium is going to stay in their body and it's going to start affecting their heart and their other organs. So, kidney failure often leads to hyperkalemia, which is another way of saying high potassium, which can cause dangerous cardiac arrhythmias that can lead to cardiac arrest. Number 10, a patient with nocturia. Now, I know you know your medical terminology. So, a patient with nocturia should be advised to, is it A, limit fluid intake throughout the day? B, drink plenty of fluids before bedtime? C, avoid daytime naps? D, reduce caffeine and alcohol consumption. So think of nocturnal. Whenever you see NOCT as a prefix in front of a word, that means something that happens at night during the hours of sleep. Urea refers to urination. So guess what this patient's getting up and doing at night? They have nocturia. Yes, they're getting up and urinating a lot, like more than normal. So what should we do, everybody? We're going to avoid stimulants. It's going to be D. We're going to reduce caffeine and also alcohol consumption because both can irritate the bladder and increase urine production. So one of my rule of thumbs is my patients who are not ambulatory, I know they're going to say, oh, decaf coffee tastes differently than regular coffee, but they're not getting regular coffee at night. They're getting decaffeinated coffee. Number one, it's a stimulant. It's going to wake you up. And then number two, it's also going to irritate your bladder. And you're going to have to go to the bathroom more frequently. So just keep things like that in mind whenever they are asking for things. What is going to be the impact of you giving someone regular coffee at 10 p.m.? They're going to have to get up. They're going to be awake, number one. They're not going to go to sleep. And number two, they're going to go to the bathroom more frequently. Question 11. Why is perineal care important for patients with urinary incontinence? A, it prevents falls. B, it prevents urinary tract infections or UTIs. C, it improves blood circulation. Or D, it reduces the need for adult briefs. Make sure you understand these questions. So many of you all say that our questions are harder than what's on the test, and I love that for you. And I love the fact that we're explaining everything to you. But other people are like, look, I don't know what these words mean, or the exact question wasn't on the test. Look, it's against the law for us to give you the exact questions that are on the test. So what you're going to have to do is you're going to have to learn terminology and learn the care concept that applies to that terminology. So if someone needs perineal care, that means that their genitals are wet, okay? So why is perineal care important for patients with urinary incontinence? Because it is going to do B. It prevents urinary tract infections. Remember, when someone's incontinent, it just may not be urine. They could also have fecal incontinence. And yes, whenever a woman defecates in bed, the urine just doesn't stop. It travels upward. So she can get fecal matter in her urethra, which can actually lead and it can grow into her urinary tract. And so good perineal hygiene, okay, helps prevent bacterial growth and infections in patients with incontinence. Whenever you're wiping, make sure you go from front to back. If you do the opposite, if you go from back from the rectal area towards the front, the way I like to say it is you put poop in the coot. Okay, we don't want poop in the coot. We always wipe from the cleanest towards the dirtiest. We're halfway done, team. I hope you are as proud of you as I am of you. We're on question number 12. What is an early sign of dehydration in elderly patients? Would it be A, high blood pressure, B, fever, C, increased appetite, or D, dark urine? And I know you know this one. I know you know that it is D. That concentrated urine is a telltale sign. So it's going to be D, dark urine. Dark or concentrated urine is an early indicator of dehydration. And so as you look at the color spectrum of the urine, whenever we have somebody on IV fluids and they are overhydrated, that's bad. The urine should not be clear. That means they're receiving too much fluids. That'd be something that you would see. Hopefully your nurse sees it. And that would prompt the nurse to cut back on those IV fluids. And so the urine should be yellow. Whether it's light yellow, maybe a little bit concentrated, we're okay with, as long as it doesn't have a smell and it's still clear. But if it is concentrated, you're going to, of course, offer your patient some water, and you're going to let your nurse be made aware. Now, if it's concentrated and it has a smell to it, well, that's definitely signs of a UTI. Okay, so concentrated urine doesn't necessarily mean they have an infection. It just means that they need a little more fluid. Question 13. Which type of urinary incontinence is caused by a sudden pressure on the bladder? Remember that word I told you to write down earlier? Would that be A, urge incontinence, B, stress incontinence, C, overflow incontinence, or D, functional incontinence? Yes, 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 yes. Great job. It is B. And I like using the image of a pregnant mother because the weight of the baby, okay, sitting on top of her bladder, that would cause B, stress incontinence. So stress incontinence occurs when pressure on the bladder from coughing, sneezing, laughing, exercising, or being pregnant causes urine leakage. During pregnancy, the growing uterus increases the abdominal pressure, which puts strain on the bladder and the pelvic floor muscles, contributing to stress incontinence. 14. Which condition is most commonly associated with an enlarged prostate? So now we're to the men. Okay, so we've covered some of the issues with women. They have shorter urethras, but now men can have large prostates. And what's going to be associated with it? Would it be A, urinary retention, B, kidney failure, C, increased urine output, or D, urinary incontinence? Right, I'm going to give you about 5 seconds to put those answers in the chat. 3, 2, and yes, it's urinary retention. So look at the image. When the prostate is enlarged, it actually obstructs the urine flow. And so sometimes they have hesitancy, like they're standing there, you're talking to your patient and you don't ever hear any urine start flowing. It's because more than likely they have an enlarged prostate. It's going to take a while for the urine to start flowing. And once it does start flowing, because of the stricture, because of the tightness, the narrowness on the urethra, they don't always get it all out. So here's our rationale. An enlarged prostate can obstruct urine flow, leading to difficulty starting the stream, but also emptying the bladder. Question 15. A dialysis patient complains of extreme fatigue and nausea. What might be the cause? Okay, this is going to be a new term for you. Is it A, low blood pressure, B, fluid overload, C, high creatinine levels, or D, high blood pressure? Extreme fatigue, they're tired and they're nauseated. That tells me as a nurse that there's an imbalance somewhere. You shouldn't be extremely tired And you shouldn't also be nauseated. So if it was just low blood pressure, I'd be thinking the fatigue, but they are now vomiting or very sick to their stomach too. So now I'm thinking abnormal electrolytes or labs. So the answer is C. Okay. Don't expect for you to know all this as a CNA, but what do I expect you to know? That whenever your patient who is on dialysis is starting to feel sick, you got to get that nurse in the room. So let's talk about it. Creatinine is a waste product that comes from normal muscle use. Healthy kidneys filter the creatinine out of the blood and remove it through the urine. But when the kidneys aren't working well, it builds up in the blood, which can make a person feel sick or tired. As a CNA, it's important to report if your patient seems unusually weak, confused, or nauseated, as these are signs of kidney problems. So if you knew number 15, I'm so proud of you. Question 16. Which intervention is best for a patient with urge incontinence? Oh, the urge. All right. So would it be A, bladder training, B, limiting physical activity, C, decreasing fluid intake, or D, wearing a diaper at all times? So, what is the intervention that you are going to provide to this patient who has urge, who has the sudden rush? Okay, like, oh, I gotta go to the bathroom. I gotta go to the bathroom. And by the time you get into by the time you get into the room, period, they've already started. They've had their incontinent episode. And so, if you chose A, that's right. We're going to have to do those Kegels. We're going to take them to the bathroom more frequently. They need to participate in bladder training. So bladder training helps them to control sudden urges to urinate by gradually increasing the time between bathroom trips. You're going to hear us talk about bladder training more frequently whenever a patient who once had an indwelling catheter, so this is more than likely hospital level, whenever we remove that catheter, they're going to be at an increased risk of having episodes of incontinence. So we have to start the bladder training. We have to ensure that they can start holding urine again without it seeping out. 17. Which urine characteristic is a possible indicator of a urinary tract infection? Would it be A, clear and odorless, B, pale yellow with no sediment, C, amber colored with no odor, or D, cloudy with a strong odor? And you all are so great. Of course, you know that the answer is D. Great job, team. So, cloudy urine with a strong odor may indicate a bacterial infection in the urinary tract. And so, there may be a couple of different type of specimens that you'd have to collect. And one would be a clean catch. Whenever a patient needs a clean catch urine, sometimes we'll have the wipes in the bathroom. They're supposed to wipe themselves first, start urinating, and then they collect the urine midstream. So we don't want the first urine that's coming out because it has all the contaminants on their body. All right, so they're going to start urinating. Either you or them put the cup under them to collect the urine. And then once you have maybe about 15 to 20 cc's of urine, that's when you can remove the cup. You'll clamp it. You're going to leave that in the bathroom because the patient is the priority. You have to help them get wiped, get their hands clean, get them back to the bed, give them the call bell, make sure they have everything. Go wash your hands. Make sure that you have your specimen bag, label everything, and then you get it off the lab. And so I know it's a lot for you to learn as a CNA, but you're going to learn it just as hundreds of thousands of others did. So give yourself grace. Question 18. Which statement about urinary catheters is true? A, catheters eliminate the risk of urinary tract infections. B, catheters should be secured to prevent tugging. C, catheters should be changed daily to prevent infection. Or D, catheters do not require perineal care. And this one is a little bit tricky, so let's see how many of you all got it right. Okay, I see some varying answers, but the majority of you chose B. Yes. So let's go back and look at some of the others. We do not change catheters daily. That doesn't happen. So if a patient is post-op, and now the sedation is worn off and they're ambulatory, well, that means that we would be removing it, discontinuing it, but we're not going to put another one in unless they have complications. All right, and catheters do require not just perineal care. You're going to clean the labia or the woman's vagina. You're going to clean the man's penis, but you also have to clean the catheter. So remember, with catheter care, it's the actual genitals and the catheter. So that would make D incorrect. B is the best response. You have to secure the catheter because that tugging can cause trauma. Of course, it's going to cause pain. And then the skin on the tip of the penis is very similar to the skin that's on the lip. And so if you're tugging on that type of skin, you could tear it. And we don't want you causing injury to your male patients or your female patients. So we're going to secure the catheter on the upper thigh, not on the hip, because it reduces trauma to the urethra and prevents accidental dislodgement. And this is called a stat lock. It's a commercial securing device. If you don't have that, you can use tape, paper tape. But we have to tape it a certain way. Otherwise, it's just going to slide through. So when in doubt, ask your nurse and he or she will assist you. 19. A patient on hemodialysis should be monitored closely for A, hypercalcemia, B, high blood pressure, C, hypotension, or D, increased urine output. This one's hard. Let's see if you know it. Revealing the answer in 5, 4, 3, 2, and remember, in dialysis, because the kidneys can't filter the waste and can't remove the excess fluids, they're going to be placed on a machine that does that instead. So whenever we remove fluids from someone's body, they could become C, hypotensive. Why is this important? Because your patient went to dialysis and now they come back to your room. We have to do weights, we have to do blood pressures, we have to monitor them because it may take a while. They're going to feel really weak, and they're going to feel weak because their blood pressure may be low. So rationale, hemodialysis removes excess fluid from the body, which can lead to low blood pressure, aka hypotension. If you're enjoying this so far, you're learning a lot, go ahead and give us a thumbs up. I didn't even ask this video. Give us a thumbs up. Go ahead and like the video, share, and if you haven't subscribed to our channel, please do so. All right, so question 20. A CNA is caring for a patient with a condom catheter. So I do have a video that talks about placing the condom catheter. It's literally a condom type device that rolls over the shaft of the penis. You have to leave some room at the tip of it so that the urine can actually drain. You connect that to a actual drainage bag. And so it looks like a condom with a drainage bag attached. Going back to the question. A CNA is caring for a patient with a condom catheter. What is the correct way to apply it? I gave you the answer. Oh, wonk, wonk, wonk. Would it be A, place the catheter tightly around the penis? B, leave a space between the tip of the penis and the catheter? Woe is me. C, keep the drainage bag positioned above the bladder level? Or D, avoid changing the catheter unless it leaks? Look, I gave you the answer. I'm so sorry, but yes, it is B. And as a reminder, we do have a video on how to place a condom catheter. It will be whenever you go to Florida Train Academy's channel, there's usually a little search area there. You can literally type in catheter or condom and you should see the video. Okay, so the rationale, a small space about 1 inch, okay, prevents pressure injuries and allows the urine to drain properly. 21. What is the main purpose of hemodialysis in patients with kidney failure? Everyone should get this right. Is it A, to help the patient produce more red blood cells? B, to increase bone strength and calcium levels? C, to improve lung function and oxygen levels? Excuse me. Or D, to remove waste, toxins, and extra fluid from the body? You learned a lot in this video. Yes, the answer is D. So hemodialysis is a treatment used for patients whose kidneys are no longer able to clean the body properly. The machine acts like an artificial kidney by filtering waste products, toxins, and excess fluids that the body normally gets rid of through urine. This helps prevent complications like swelling, high blood pressure, and confusion. Question 22. A CNA notices a patient with an indwelling, you may hear us call it a Foley, but an indwelling catheter has no urine output for 4 hours. What should be the first action? Is it A, remove the catheter immediately? B, increase the patient's oral fluids? C, check for catheter kinks or blockage? D, call the provider for catheter replacement. All right, I'm gonna give you a few seconds with this one. The correct response in 3, 2, and that's right. You have to check for kinks. Always troubleshoot your equipment, and you start off with the patient. Okay, so you're starting off at the genital area. You're going to tell the patient, I don't see any urine in your bag. Going to make sure you wash your hands, glove up. Is it okay if I pull your covers back? I just need to check everything. And you're going to start checking, and you're going to look for any kinks, look for any anything that be causing the urine not to flow downstream. And if you don't see anything, that's when you'll get your nurse in the room. So before assuming a serious issue, the CNA should first check for simple problems like a kinked or blocked catheter, which is a common reason for no urine output. 23. Which of the following symptoms is most concerning in a patient with end-stage renal disease? Remember, this is really bad, okay, end-stage. This is probably going to be the cause of their death. So which of the following is the most concerning? Would it be A, increased thirst, B, itchy skin, C, frequent urination, or D, sudden confusion? Yes, you all are so smart. You all are so smart. I'm so proud of you. It is D, okay, sudden confusion. Confusion may indicate dangerous electrolyte imbalances such as high potassium levels, which can affect heart function. All right, so remember, you're not the nurse. You're alerting the nurse to changes. This patient who was okay during the daytime and now they're like acting confused, it may not be sundowners. It could be that their electrolytes are imbalanced. So you do what you do as a great CNA. You notify the nurse of any changes and then allow that nurse to do the rest. Question 24. Which of the following is a common cause of UTIs in male patients? Would it be A, poor oral hygiene, B, high blood sugar levels, C, enlarged prostate blocking the urine flow, or D, a high fiber diet? Yes, 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 and yes. You all are awesome. It is C. Remember that enlarged prostate causes urine to be retained. So in male patients, an enlarged prostate can press against the urethra and make it difficult to completely empty the bladder. When urine stays in the bladder too long, bacteria can grow and cause a UTI. CNA should watch for signs like frequent urination, pain, or changes in urine color and report them to the nurse. Team, we made it to question 25. I'm so proud of you. So why is E. coli commonly found in the urine cultures of female patients with urinary tract infections? Is it A, because E. coli is found in the air and enters through breathing? B, because women often drink less water than men? C, because women have stronger immune systems that trap bacteria in the urine? Or D, because E. coli from the digestive tract can easily spread to the urinary tract? I already gave you this answer, so let's see if you remember it. And yes, and you remembered it, and you remembered it. Great job, team. Remember, when a woman has a bowel movement in bed, even if it's not a lot, the fecal matter just doesn't go down, it also spreads up. So the answer is D. E. coli is found in fecal matter. The vagina is a no poop zone, so make sure you keep that area as clean as possible. Your patients, they don't know. They've had accident in bed, and now when you spread their legs, you're going to still start from the top, the vaginal area, and start wiping down. So E. coli is a bacteria normally found in the intestines. In females, the urethra is shorter and closer to the anus, making it easier for the bacteria like E. coli to move from the rectal area to the urinary tract. This increases the risk of UTIs. CNA should encourage proper perineal hygiene, wiping front to back, and help prevent infection. You all, I am so proud of you. Look, I gave you a bonus question. Let's see if you can get this one. Which of the following is a correct CNA responsibility when caring for a patient with a Foley catheter? A, changing the catheter if there is buildup near the meatus. The meatus is the tip of the penis. B, flushing a catheter tubing if urine output is low. C, gently cleaning around the urinary meatus and catheter each shift. Or D, applying powder near the meatus to keep it dry. You all, please don't put any powder on the tip of a man's penis, so don't do D. All right, so great job, you all. Yes, you're going to provide catheter care, whether it's to a male or a female, once per shift. So the answer is C. And yes, I got a video on that for you. So the urinary meatus is the external opening of the urethra where the urine exits the body. We're aware of that. CNA should clean around the urinary meatus and the catheter insertion site at least once per shift or as directed by the care plan, or as needed based on what the patient did in bed. Okay, if they're incontinent, you may have to clean them more. How are they incontinent with a catheter? Well, sometimes, again, the fecal matter can come up to the front, and that catheter tubing could get fecal matter on it. So you're going to clean any place that is dirty. So this helps prevent infection and maintain skin integrity. CNAs are not responsible for flushing or changing catheters, and powders can irritate the area or increase infection. So we don't put powder on our patients anymore, you all. And guess what? You did it. Look, I have all of the CNA skills on one video. You can use your phone, your camera app to scan the QR code that's on the screen, or you can just simply go to our description area and go to our YouTube channel. And you all know how much I love you and what we say at the end of every video. You're doing this the right way because caring CNAs become caring nurses. And we need more people who care, more people like you. And I know you're going to ask, when's my next live? We are going live every Wednesday night. Okay, so every Wednesday night, if it's a day that we actually have our CNA students in house, it'll be 9:30. But this week, we went live at 8:30. So it's either going to be 8:30 or 9:30. Always turn on your notifications so that you will know when our next live stream will be airing. And for those of you all who've already purchased our $7 Vital Sign bundles, thank you. We appreciate you all so much. That helps to support our team. Buy them coffee, buy them lunch, you all. They put in hours of work helping to create the videos, the guides, all the other things that you all love. So whenever you help support us, we so appreciate you. And some of you all even give a super thanks. So thank you. And that's it, everybody. Thank you for watching. Thank you for liking. Thank you for learning. And thank you for subscribing. We appreciate the care that you give to the patients and the care that you give to one another. So I love you, and I'll see you in the next video. Bye.